Anxiety is a much misunderstood term. People mean different things when they use that word. And anxiety disorders are multiple, varied, and mean different things to different people. Symptoms of anxiety can limit one's ability to function, to be productive, to have good relationships, and to do well in the community and at work. For generalized anxiety, which means overall anxiety, some of the symptoms might include irritability, excessive worrying, poor concentration, fatigue during the day, or sleep disturbance. Many people don't think of those symptoms as being related to anxiety, but they're classic anxiety symptoms for generalized anxiety. Other anxiety disorders include such things as panic disorder and panic attacks, which are very traumatic to the patient, very serious and very severe, and can limit one's ability to function. And panic attacks are often characterized by sudden onset, difficulty breathing, sometimes nausea, dizziness, chest pain, a sense of impending doom, or thinking one is having a heart attack or that one is going to die. And those are symptoms of a panic attack. And there's a disorder called panic disorder, and that can be treated very successfully and easily, provided the correct diagnosis is made. Other anxiety disorders include such disorders as obsessive compulsive disorder or post-traumatic stress disorder. Post-traumatic stress disorder is much more common than we recognized a few years ago, and it now is diagnosed much more frequently, although I think it's still underdiagnosed. And symptoms of that are wide-ranging and may vary from having nightmares of the event, and there has to be a traumatizing event, a single event that was responsible for the initial trauma, but recurrent memories of the event, nightmares of the event, changing the way you feel about your ability to relate to other people, something we call hypervigilance, which is like being on the alert all the time for danger or something bad happening to one. Those are some of the symptoms, and there are a wide variety more. And you've all heard the term OCD, obsessive compulsive disorder, and that is characterized by rituals where there's ritualistic behavior. For example, washing your hands excessively, too many times an hour, too many times a day, with experiencing your hands turn raw because you're washing them so much. And obsessions, which are thoughts that you can't prevent but don't like because they're unpleasant and they're not consistent with the way you think. So it might be thoughts about something you really disapprove of, yet they come into your mind and they don't go away. Those deserve diagnosis. And there's good treatment. There's both psychotherapy treatment for OCD as well as medication for OCD. That's also true for the other anxiety disorders. If you treat an individual with medication only, very often you don't get an optimal outcome. It's best when you use a combination of psychotherapy and psychotropic medication, and then you get the results that you're really looking for. If you have any questions or would like more information, give me a call at 908-305-6404.